Good morning, everyone. This is Bonnie Hackbarth with the Foundation for a Healthy Kentucky. I'm going to wait about 30 seconds and then we'll get started. Okay, good morning, everyone. I hope everyone's doing well during this time and so grateful that you're all joining us this morning. I am Bonnie Hackbarth of the Foundation for a Healthy Kentucky, and I'm honored to be your moderator today. I'm joined by several health policy experts who care deeply about the health of Kentucky's people. We're looking forward to learning from them about the policy tools that local officials can use to improve their community's health by reducing tobacco use. This webinar is brought to you by a partnership of the American Heart Association, the Foundation for a Healthy Kentucky, and Kentucky Youth Advocates. These three organizations work every day, just like you, to support policies that make Kentucky a healthier and better place to work and live. Our work reduces the health care and other costs that keep so many of our residents from enjoying their best lives and that limit our community's economic growth. This webinar will be recorded, and we will follow up with a link so that you can share the recording and the PowerPoint slides with your colleagues and fellow local leaders. The microphones of all except the current speaker will be placed on mute during the webinar to ensure optimal sound quality. We do welcome your questions at any time, however. Just type them into the chat box on your screen, and we'll answer as many of them as we can during our Q&A segments that we have scheduled this morning. We also will capture any unanswered questions and provide answers in a follow-up email to all registered participants, along with the links to the webinar recording and the slides. So we'll begin today's program with two presentations that tell us the current story of the toll of tobacco use in Kentucky. I'll introduce both of those speakers now and then ask them to go ahead in order. First, we're thrilled to welcome John Cox, a native of Lexington, Kentucky, who serves as Manager of Public Affairs at the Kentucky Chamber of Commerce. John has graciously agreed to stand in for Chamber CEO Ashley Watts, who had to make an unexpected change in her schedule. John also staffs the Chamber's Healthcare Policy Council. He previously was Communications Director for Senate President Robert Stivers, and also for the Kentucky Tourism, Arts, and Heritage Cabinet. And he is now the Chamber's lead policy advocate for healthcare issues. John will be speaking this morning about why the Chamber supports efforts to reduce tobacco use. Our second speaker will be Elizabeth Anderson Hoagland, Health Promotion Section Supervisor at the Kentucky Department for Public Health. Before being promoted to her current role, Elizabeth served as Youth Tobacco Prevention Coordinator at the department, and she knows the ins and outs of tobacco's impact on individual and community health in Kentucky better than just about anyone in the state. And so we'll start with John. Please go ahead.
Well, thank you so much, Bonnie. It's a privilege to be here today, and I was glad that it worked out that I could fill in for Ashley. So we're going to go ahead and get into the cost of Kentucky's tobacco rates on our Kentucky businesses and why the Chamber and our business community is behind these efforts for a smoke-free tomorrow. So first, a little bit about the Kentucky Chamber of Commerce. We are Kentucky's largest business organization with membership across the Commonwealth, ranging in size from sole proprietors to some of the largest employers in the Commonwealth. Our motto is uniting business and advancing Kentucky, and our mission is to support a prosperous business climate in the Commonwealth. working to advance Kentucky through advocacy, information, program management, and customer service in order to promote business retention and recruitment. So our focus at the Chamber all kind of centers around 4 pillars of prosperity in our advocacy efforts. As you can see here, we have Pillar 1 is a healthy, educated, and skilled workforce. Pillar 2, quality, knowledge-based jobs. Pillar 3, 21st century infrastructure. And Pillar 4, effective and efficient government. And I think it's, I'm proud to say that Pillar number 1 is for a healthy and educated and skilled workforce. So what does that mean? We must create a globally competitive talent development system that produces a healthy, educated, and skilled workforce, benchmarked against the best education and workforce preparation systems in the world. But as many of you know, we have plenty of work to do in this state. Kentucky is one of the nation's unhealthiest populations, with consistent rankings at or near the top of the list in smoking rates, obesity levels, and other indicators of poor health. And Kentucky's health status has a significant impact on the business community. It increases employers' healthcare costs and hinders their ability to hire a healthy and productive workforce. Preventing disease before it starts is critical to helping people live longer, healthier lives and keep healthcare costs down, and that includes for businesses. The Chamber encourages employers to implement wellness-based programs that promote prevention and prompt workers to improve their healthy habits. So now I want to get into the cost of smoking-related illness in the United States, which accounts for more than $300 billion each year, according to the CDC. And to break that down, nearly $170 billion of that is for direct medical care for adults, and then $156 billion plus in lost productivity, including $5.6 billion alone in lost productivity just due to secondhand smoke exposure. In 2019, Kentucky ranked 49th out of 50 states in smoking rate, and that's as a percentage of adult smokers who reported smoking at least 100 cigarettes in their lifetime and currently smoke either daily or some days. And as you can see here, the trends have started to decline in terms of overall smokers in the state, but they're still well above that national average. So to break down those numbers at the state level, annual health care costs in Kentucky directly caused by smoking, that's $1.92 billion. Medicaid costs caused by smoking in Kentucky, just under $600 million. Residents' state and federal tax burden from smoking caused government expenditures, that's $1,074 per household. And then smoking caused productivity losses in the state, $2.79 billion. So that's a major concern for us. And so when you break it down, why are businesses so concerned with, smokers? And there have been plenty of studies to show just how these habits negatively impact employers and our business community as a whole. So compared with non-smoking employees, those employees who currently smoked were 33% more likely to miss work and were absent from the workplace for an average of 2.7 more days per year. And that absenteeism decreases when smokers quit, even among those who have recently quit. So smokers are also more likely than non-smokers to take unsanctioned breaks. And these breaks are the largest single cost from a smoking employee and result in 8 to 30 minutes per day per employee in lost work time. Another study showed that when comparing an individual who smokes tobacco to a non-smoking employee, businesses or employers are paying an estimated excess cost of nearly $6,000 annually for employees who smoke. $6,000 annually per smoking employee. I mean, that adds up over time. So, and contributing factors examined in the study were, like I said, absenteeism, presenteeism, smoking breaks, healthcare costs, and pension benefits for smokers. On average, employers pay an additional $659 per year in medical and pharmacy costs for each employee who smokes, and breaking down that $6,000 per year. Across the United States, anywhere from 6 to 18% of total healthcare expenditures are attributed to smoking-related illnesses. And tobacco use is also associated with increased risk of injury and property loss due to fire, explosion, and vehicular collisions. The National Fire Protection Association found that in 2011, smoking caused 1,960 fires in non-residential structures, resulting in direct property damage of $39 million. So fire insurance costs are typically reduced by up to between 25 and 30% when businesses go smoke-free. So, I mean, those things all together, it adds up. And workplace smoking interventions, these may also reduce those costs to employers. We might save $150 to $540 annually for each smoker who quits, depending on quit rates, cessation and drug costs, and including both healthcare costs and non-healthcare costs, such as lost earnings and absenteeism. So because of all of that, I want to show you a poll. We do an annual poll, usually around this time every year, of our membership. In this case, we had, I think it was around 100 or so employers that are Kentucky Chamber members answer a plethora of questions, just policy questions all over the map. But when you get to specifics about tobacco use and employers and employees, we'll go over these. I mean, do you support raising the cigarette tax an additional 50 cents? 89.8%, almost 90% answered yes to that question. And then an additional $1 on the cigarette tax, it's not a huge amount of variation. It's 80.4% still said yes. And should we tax e-cigarettes at the same rate as cigarettes? 93.9% said yes. So employers are taking note, and that's why we've been so vocal in our advocacy efforts in Frankfort. Lock in step with the Foundation for Healthy Kentucky and Coalition for a Smoke-Free Tomorrow, passing those, legislative measures like the Tobacco 21 law and raising that tax on e-cigarettes and cigarettes. So, we're happy with the progress we've made, but we definitely still have a long way to go. And with that, I will turn it back over to you all. Thank you so much. I appreciate it.
Thank you, John. You make it clear that reducing tobacco use is as much a business success issue for Kentucky as it's a consumer health issue. So let's hear about the consumer side now from Elizabeth Anderson Hoagland. Elizabeth?
Good morning, everyone. This is Elizabeth Anderson Hoagland from the Kentucky Department for Public Health, and I'm going to be talking a little bit about the use of tobacco products in Kentucky, as well as the health consequences of tobacco use. So if we look at Kentucky, we rank second in the nation for adult smoking and second in the nation for youth smoking. And I have to say, we're second usually to West Virginia. If you look at the numbers, we are within a statistical variance, so really we're pretty much neck and neck. When you look at tobacco, the most common tobacco product among adults are cigarettes. The most common tobacco product among youth right now are e-cigarettes. So I'm going to go through the youth data a little bit. This is data from the Kentucky Incentives for Prevention survey that is given to middle schools and high schools by school district across the state. You can see it's broken down into regions across the state. And if you look in the upper left-hand corner of your slide, that compares KIPP data in blue, which is Kentucky-specific data, to the red data, which is the National Monitoring the Future survey. Looking at cigarette use, we do look at 30-day use because most high school students are not daily smokers. And we look at 10th grade data because we know some of the highest risk youth tend to drop out when they turn 18, so they might not be reflected in 12th grade data. So this is looking at 30-day cigarette use among 10th graders across the state. You can see that it is lowest in the more urban areas of the state, and it is highest in the more rural areas of the state. There's a couple of different reasons for this. One of them is smoke-free policy, and one of them is denormalizing cigarette smoking in those more urban areas of the state. You can see that smoking rates have gone down both at the national level and at the state level, which is excellent. Here we're looking at 10th grade smokeless tobacco use. And again, it is lowest in the more urban areas of the state and is highest in the more rural areas of the state, especially towards the Appalachian region. And really, if you look at this, and I'm happy to share my slides, There are some areas of the state where we have higher smokeless tobacco use than we do cigarette smoking. And there's a couple of different reasons for this. One, we have a lot of restrictions on flavors for cigarettes. There are not so many different restrictions on flavors for smokeless tobacco. We also have much lower taxes on smokeless tobacco than we do on cigarettes. When you look at youth, they are very price sensitive and they are very sensitive towards flavors. You know, that mint flavor, that cherry flavor is much better than straight up tobacco flavor. And then here we're looking at e-cigarette use. And there is no clear, consistent story with who is using e-cigarettes and who is not. It is everywhere across the country. It is everywhere across Kentucky. You can see in some areas of the state, we have up to 30% of our 10th graders are current e-cigarette users. And it's also important to note that e-cigarette use is increasing. It's also important to note that there are hundreds of different types of e-cigarettes on the market. And so what youth are using in one area of the state could be different than what they're using in another area of the state. So I'll tell an embarrassing story on myself. If there's anyone here from Corbin, I was in Corbin last February, and I was at the high school, and I gave my spiel about Juul, about how bad vaping is, and Juul, e-cigarettes, blah, blah, blah. And after my presentation, 2 high school girls came up to me, and they were very nice and just a little bit condescending. And they said, no one here has used Juul since August. And I said, oh. And they said, we use Smoke Novo. I said, oh. And they said, but the Smoke Miko just came out, and that is the Gucci of e-cigarettes. And I was like, oh, the Gucci. So there's a couple of things to note about that. One, they called it a Smoke Novo and a Smoke Miko. And if you've ever seen this product, it's spelled S-M-O-K. So in Corbin, they call that Smoke. If you go a couple of counties over, they're going to call that Smock. So you really have to talk to the young people in your community to know exactly what products they're using, to make sure you're using language that accurately reflects the reality. The other thing to note, the U.S. Food and Drug Administration put some flavor restrictions for e-cigarettes into place in February for pod-based systems like Juul. But those flavor restrictions don't cover refillable products such as the Smoke Miko or the Smoke Novo. So those flavor restrictions might restrict Juul use, but they're not going to restrict the use of products that are being used in Corbin as of February of last year. And here I have county by county level data for current smoking among adults. This data is actually a combination of a couple of years of data, so we could get down to the county level. Again, we see in the more urban areas of the state, we have a lower prevalence of smoking. In the more rural areas of the state, we tend to have higher prevalence of smoking. Now, the thing about smoking is that it remains the leading preventable cause of death and disability in the United States, causing about 500,000 deaths per year. Now, if we look at how those deaths break down, lung cancer, heart disease, chronic obstructive pulmonary disease are the top causes of death. We know that smoking impacts every single organ of the body. Kentucky ranks first in the nation for cancer deaths. It ranks second in the nation for prevalence of chronic obstructive pulmonary disease, and ranks ninth in the nation for heart disease deaths. And again, we can see that at the county by county level. So if you look at cancer deaths, they are much higher in the Appalachian and eastern regions of the state than they are in the more urban areas of the state. There's a couple of reasons for that. One is those higher prevalences of cigarette use and tobacco use in the more rural areas of the state. We also have really high rates of radon in Kentucky, which is a radioactive gas. And so if you have a combination of radon and cigarette smoking or secondhand smoke exposure, that exponentially increases your risk of cancer. Here we're looking at heart disease deaths. Again, that's higher in the Appalachian and mountainous regions of the state. Again, that can be due to cigarette use, as well as lack of opportunities for physical activity and poor nutrition. And I apologize that this is such a large map. It's hard to see down at the county by county level. But this is prevalence of chronic obstructive pulmonary disease by county in the United States. It is a little bit old, but this is the best map I could find that really showed that Kentucky has a significantly higher number of counties that have high rates of COPD compared to almost anywhere else in the country. We're kind of neck and neck with West Virginia again. But again, it's that swath along the Appalachian eastern side of the state we really see the highest rates of COPD. Now, I showed a whole lot of data, so here are my citations. If you have any questions, or if you'd like a copy of those slides, or if you'd like a copy of where I got that data, feel free to get in touch with me. Email is probably best because I'm working from home. So thank you all very much.
Thanks, both to Elizabeth and John. I hope you've given us a lot to think about in terms of the problems that Kentucky's high rate of tobacco use cause for our people, our state and local budgets, and for our business community. Certainly health advocates at the local and state levels in Kentucky have worked hard over the last decade to address some of these issues, but tobacco use is still causing tremendous issues for our communities. Next, we will hear from Betsy Vetter, who is the National Field Grassroots Director for the American Heart Association. Betsy has been a leader in a variety of public health advocacy efforts on behalf of the Heart Association in North Carolina and the Mid-Atlantic region for nearly 20 years. She works with communities all over the country and will share some of the strategies that community leaders can use to reduce the toll of tobacco use. She'll also talk about the tactics that big tobacco manufacturers have used to reduce the ability of local jurisdictions to address these issues. Betsy.
Thank you so much, Bonnie, and good morning, everyone. I'm very happy to be with you, and just want to say that for years I've had the opportunity and the privilege to work with my colleagues in Kentucky, and just was really tickled to be invited to present to you this morning and talk a little bit about the importance of grassroots and advocates being engaged in the process of building longer, healthier lives in their communities, talk about the role that our local governments and our local towns have in that process, and then talk about the tactics that are used that get in the way of the work that we're trying to do. So thank you all so much for having me, and let's just go ahead and get started. Local governments are uniquely positioned to meet the needs of the people in their communities. They should be able to pass laws that are proven to promote good health, well-being, and equity. Good ideas often start at the local level. As an example, local governments were the first to pass indoor smoke-free laws, but the ability of local governments to pass these kinds of laws is now at greater risk than ever before. When states block communities from passing their own laws, it weakens local government's ability to innovate and enact laws that promote health and equity and improve people's lives. So let's talk about what is this? What is the policy that drives this? So the question becomes, what is preemption? It's when a higher form of government, such as the state legislature, discourages, limits, or even eliminates a lower form of government, like a city council, to act over a particular issue. And so you might wonder, when we think about the industry, why preemption? Why did they hone in on this? And I think their own words best describe it. Back in the 1980s and 90s, one of the tactics of the tobacco industry, when they started to see work bubbling up from local communities to protect people from secondhand smoke, was to use preemption. And back as early as 1995, Victor Crawford, the former Tobacco Institute lobbyist, said, "We could never win at the local level." So the Tobacco Institute and tobacco companies' first priority has always been to preempt the field, preferably to put it all on the federal level. But if they can't do that, at least on the state level. And I think that's the key. They can't fight every single community as an industry. But if they, narrow where they have to go to battle to states or the federal government, they can take all of their industry resources and put it there. So that's why preemption. So now let's take a look at what are the types of preemption that exist and what's the current status in tobacco. So there's three main types of preemption. The first is express preemption, which is a statute which explicitly asserts the state's intent to occupy the field in a given subject area. The second is implicit. The court interprets a statutory scheme to be so comprehensive as to implicitly occupy the field and preclude local or state control. And then the third is practical. Bureaucratic hurdles, referendums, restrictions of authority. Industry strategies and language change over the years, but their goal remains the same. So now let's take a little closer look at what is the current status of tobacco preemption in Kentucky. State law limits or preempts the types of tobacco control measures that local jurisdictions can adopt, thus minimizing their ability to respond to local public health concerns related to smoking and tobacco use. In Kentucky, KRS 438.300, which we don't expect anybody to remember, preempts local jurisdictions from enacting tobacco control measures regarding the use, the display, the sale, and the distribution of tobacco products sold in the state. It creates a ceiling for virtually all measures to reduce tobacco use in the Commonwealth, except smoke-free indoor air laws. In addition, Section 181 of the Kentucky Constitution has been interpreted to prohibit local jurisdictions from imposing an excise tax on tobacco. So now, let's take a little closer look at why all this effort to thwart local policy. People have more trust in their local government to get things done and they hold them accountable for their actions. It's a lot easier to look at your mayor, to look at the town councils, the county commissioners, people that you see in your community, and hold them accountable for the things you want to see done. Our local governments have a broad range of services and responsibilities to the communities that they serve. And city and county government employees are the ones on the ground improving communities and interacting with all of us as citizens. The policies created by our local governments affect everyone in the community in some way. Public policy determines what services will be provided to the residents and the level of those services, what kinds of development will occur in the community, and it determines what the community's future will be. Local government is important to each of us because it takes care of local issues. Local policies manage the issues that are nearest to your day-to-day life. So by a large margin, the general public believes local government should be allowed to build and improve on minimum standards set by the state to reflect the unique character and the needs of their community. People really do believe that one size does not fit all, and voters view local governments as the best opportunity to get what matters to them done. So, what can we do together using local policies to reduce the toll of tobacco, and what's happening sort of in a broader picture? We're seeing trends all over the country for local governments to protect the public and especially our youth from starting the use of tobacco or vaping products. The policies being adopted cut across a number of different approaches. Some are policies many of us are already familiar with, including comprehensive smoke-free laws and taxation, which was already mentioned this morning. Kentucky has taken steps locally to adopt strong smoke-free laws, protecting workers and the public from secondhand smoke. But as you know, in Kentucky, local governments do not have the ability to take other steps, like increasing tobacco taxes. In recent years, we've seen local governments take action to regulate the use, display, sale, or distribution of tobacco products, including e-cigarettes, commonly referred to as vaping products. Unfortunately, in Kentucky, you are preempted from acting locally in any of these areas. With the adoption of raising the sales age for tobacco products to 21, many local and state governments are also regulating and restricting access to tobacco products. This includes adopting and implementing tobacco retail licensing laws. Not only do these laws hold store owners accountable for following the law, the licensing fee also provides an important source of revenue. So the reality is one size doesn't fit all. Local governments need the flexibility to create laws that most accurately reflect the unique views, the values, and the needs of the people who live there. When states block communities from passing their own laws, it can hurt the health and well-being of our families, our friends, and our neighbors. Local governments in Kentucky need the ability to regulate the use, display, sale, or distribution of tobacco products, including the vapor products, to address nicotine addiction, especially among our youth. So, what are some of the steps you can take in Kentucky to restore local control? Let's start with understanding who's impacted most by a policy we're discussing and the importance of making sure that that group is engaged in this effort. Since preemptive policy by the state takes away the ability of local governments to act, local officials are directly impacted by it. It's their power to adopt policy change that's restricted. It's important they're engaged in the effort to protect or restore their authority. We've already seen how local policies impact communities. So the grassroots constituencies are impacted, and when they can't advocate locally for the changes their communities need, we need to make sure both those groups are engaged together in this effort. It must be a top priority, and these groups must work collaboratively. You want to be sure all the parties are educated about the issue, have regular communication so everyone stays informed, and you build your power together. Local officials are key to this issue. Not only are they directly impacted by it, but as an elected official, they have access other advocates may not have, even your health partners. For example, they may have relationships with other influential locals like business leaders, faith leaders, etc. That may know who has relationships with state officials. As a group, local officials can become advocates.
Betsy, let me interrupt you for just a second. If there's a speaker on the line who does not have their phone muted, please do so until Betsy finishes her presentation. Thank you so much. Betsy, please continue.
Thank you. So as a group, local officials can become advocates themselves and prioritize the issue, making sure it's on the priority list for their state lawmakers. The bottom line is the grassroots need to work together and collaborate all along the way. It will help carry a consistent, strong message to state lawmakers. As grassroots advocates, you'll also want to make sure the media, especially the local media, is informed, educated, and covering the issue. You can do this a number of ways, including using letters to the editor, opinion editorials, and meeting with editorial boards. The Coalition of Health Partners are ready to help you with information if you'd like to engage with the media. And don't forget the power of social media, especially for creating more awareness. You are already on today's call, and you want to learn more. It means you have interest and want to get engaged. So what comes next? How do you make a difference? Start with education. Make sure communities know why local control matters and help them spread the word. As leaders yourselves, engage others in becoming advocates. The health groups offering today's webinar are ready to help you with resources and tools to build your grassroots. It's important to remember to build your relationships now. Grassroots is all about people. We are people power. And when we are advocating, it's about influencing others. So remember one rule of thumb with relationships. Build the relationship first. Get to know both the advocates and the elected officials before you ask them to do something. Let's face it, we all do things for our friends. We read what our friends send us. So use that philosophy and take the time to grow your relationships now. In today's world, we have many forms of communication. So as they say, variety is the spice of life. Use that to help you meet people where they are. If you have groups that are more connected via social media, utilize that. If it's email, use email. If it's phone calls, call them. You know, we're in the middle of a pandemic, and we may have to do things virtually like we're doing today, and that's okay, because today we have Zoom, we have FaceTime. There's lots of options at your disposal. Remember to give the grassroots options to engage. People want to help. Have them sign a pledge to support the effort. Invite them to advocacy workshops and trainings, and ask them to take action. Everything from recruiting more advocates to making phone calls to attending meetings. Grassroots want to grow and make a difference. In closing, we're all the grassroots. We are members of our communities. If you're an elected official, you still have people that represent you. And when you want to see change happen, you need to advocate for that change too. By working together, you'll be successful. Remember, as Margaret Mead once said, never doubt that a small group of thoughtful, committed citizens can change the world. It's really the only thing that ever has. So thank you all very much. Look forward to answering any questions you may have.
Wonderful, Betsy. Thank you so much, and thank you for the specific examples of some of the tools that you gave us. And I agree completely that it's about relationships, and it's about using the opportunity to chat with people you know and you've worked with over a period of time who trust you, to share the stories of the things that we can do to change Kentucky's smoking and tobacco use rates. I have a couple of questions already, and I want to invite everyone on the line now to type questions into the chat box, and we'll start with this one. And I'll direct this initially to John Cox, and then maybe anyone else who wants to jump in, Betsy or Elizabeth. And the question is, how realistic is it that Kentucky will raise a tobacco tax another 50 cents to $1 on cigarettes, and then also fully tax e-cigarette products at the same rate as other tobacco products? So, John, can you talk about tax possibilities in 2021?
Sure. And to answer the question, I think it's kind of a two-part question. I think it's somewhat realistic on the first part, as to will Kentucky raise its tax on tobacco another 50 cents. I mean, unfortunately, we're always in need of revenue, and it's a fairly, it's a lot less controversial way to raise revenue than others. So, I think that's a possibility. There's still, a tradition of agriculture in our state that at one time was highly dependent on tobacco as a cash crop. So there's still generational ties to the tobacco industry, and still some farmers that are growing tobacco and relying on it to make their living. And so, that gives us some trouble in certain parts of the state in terms of voting on, anti-smoking, anti-tobacco legislation. But, unfortunately, that tradition, as we've said, goes right along with the tradition of poor health outcomes in our state. So, I think people are aware, obviously, of the negative impacts it has on our people, our youth, and our workforce. And I think that it's definitely a possibility that we'll raise tobacco another 50 cents. As far as the second part, will we fully tax e-cigarette products at the same rate, at the full rate as other tobacco products? That one I think is a little trickier because, a lot of the vape shop owners and a lot of the advocates for companies like Juul make the argument that, that e-cigarettes are a healthier alternative to traditional cigarettes. And I think that we still have some work to do from a PR perspective to convince legislators. Otherwise, not all legislators, obviously the ones about to come on and present are certainly, on our side of the argument. But, I think it's yet to be seen. There's still plenty of studies that'll say that they are not. There's no proof that there's that e-cigs and vapes are a healthy alternative or a better way to kind of get towards quitting. But we still have some work to do as far as messaging that and getting that research out there to our members. So the first part I think is more likely than the second part. Yeah.
Okay. Well, and this is a question maybe for Elizabeth Anderson Hoagland as a follow-up, and maybe Betsy Vedder. What level of tax increase will actually curb tobacco use? Do we know? We sort of know that for cigarettes. Do we know that for e-cigarettes? Let's start with Betsy on that.
So we at the American Heart Association are advocating to create the consistency with regular cigarettes for taxation for e-cigarettes, and do not agree that they are not harmful. I mean, we have to be, I think you're right that it comes back to education. My recommendation for taxation policy would be to start with the education piece and the grassroots piece to make sure people are talking about it. And so, I think we would want to see it come in line with cigarettes and be treated the same. So that's where we're at in terms of looking at that. I will say that taxation policy as a policy has been really instrumental and scientifically proven, especially in tobacco, to really impact two groups of people. The first is our youth. Taxation policy and that cost price point really impacts youth and can really be a deterrent to keeping youth from ever starting the use of tobacco. And then the other group is pregnant women. We have found over the years that when the price of tobacco goes up significantly, it impacts pregnant women and keeps them from starting to smoke. So I think those factors remain the same. It is a very effective policy tool, and I think you start, if there's interest, there's a couple reasons why Kentucky might want to look at it. One would be, is there going to be a state deficit that needs to be filled? And if that's the case, it may open the door for the conversation and gives you that point to talk with your grassroots and talk with your lawmakers about it.
Mm-hmm. And we do have a very high rate of smoking among pregnant women in some counties of Kentucky. It's over 40%. There's also a question here about whether Northern Kentucky businesses support smoke-free initiatives as strongly as other parts of the Commonwealth. And that question was for John, but I'm going to step in and just tell everyone that our Kentucky Health Issues poll, which is an annual poll of Kentucky adults about a variety of health questions, shows strong support across the state for that and also in Northern Kentucky. It is somewhat lower in Northern Kentucky than in the rest of the state, but still well above majority. So very high level there among the adults in the Commonwealth. John, any additional quick comment on that before we move to our next speaker?
I'll just piggyback and say that Kristen Baldwin, who is Vice President of Public Affairs for the Northern Kentucky Chamber, has been with us every step of the way in our meetings with the coalition, and I would say that they are in strong support as the other areas as far as what I've seen. I haven't seen broken down numbers, but I get the sentiment that they are. Yes.
Thank you. There's another question here about local for elected officials, and they'll be coming up here just very shortly. So I'm going to hold that question until they're on the panel. Thank you so much, John, Elizabeth, and Betsy. We invite you to stay on the line to hear from our next speakers, but really appreciate the expertise that you shared. Next up is Representative Kim Mosier, who has represented District 64 in Northern Kentucky in the state legislature since 2017. Representative Mosier chairs the Health and Family Services Committee in the Kentucky House of Representatives, and as a professional nurse and physician spouse, she's been very supportive of our efforts to reduce tobacco use in Kentucky. We're quite honored to have Representative Mosier join our webinar today to share an overview of state policies that govern tobacco use and marketing in Kentucky. Representative Mosier, please go ahead.
Yes, thank you so much, Bonnie. Thank you, everyone, for the opportunity this morning to speak to you about this really important issue. It's a pleasure. I just want to say it's a real pleasure to work with Bonnie and the Foundation on so many things that really find solutions to improving Kentucky's notorious poor health, unfortunately. So this morning what I'm going to do is walk through a few laws, federal, state, and local, that already exist. They already govern the marketing and the sale of tobacco products in Kentucky. And obviously these laws help reduce the use and associated healthcare costs with tobacco use. There are already, as I said, several laws in place, but there are many other ways to improve the health of Kentuckians. So that's what we're going to do here. At a federal level, the most comprehensive law governing tobacco products is the 2009 Family Smoking Prevention and Tobacco Control Act. This law gave the U.S. Food and Drug Administration control over things like standards for what goes into tobacco products, including e-cigarettes. It also adds provisions for how tobacco products are labeled. For example, the graphic health warning that you see on the slide is just one of many rotating warnings that will be required on cigarettes starting in September of 2021. Right now, tobacco products are only required to have large black and white print, the Surgeon General's warning labels that you've probably seen about the health risks of tobacco use. And we know that research shows that graphic warnings will be much more effective in conveying those risks. So I think that adding this is a very good thing. The FDA can also restrict marketing practices that target underage persons. This is the authority that the FDA uses to do things like ban flavored e-cigarette juices that are packaged to look like candy, for example. Also, the FDA used this authority to partially ban fruit and mint flavored e-cigarette cartridges starting this past February 6th, 2020. The ban has some exemptions that worry some health advocates, and most notably, and you've probably heard about this, it still allows menthol, and it's proven that menthol is very difficult to quit. It also allows flavored disposable e-cigarettes, which are beginning to replace the Juul brand e-cigarettes as the most popular products for our young people. So clearly there's more that we can do here. I know that you're probably familiar with cartoon characters being used in advertising, and these are also banned under this law because they appeal to kids. Joe Camel is a great example. It became nearly as recognized as Mickey Mouse among children in the 1990s. And so this was first challenged by the Federal Trade Commission in the late 1990s, and the 2009 law just codified and this resulting ban. The 2009 law also allows the FDA to determine whether e-cigarettes can be sold in the U.S. at all, and this is based on their impact on public health. The process for that decision requires manufacturers to apply for the right to sell e-cigarettes. The deadline for submitting this pre-market application has been extended to September 9th, 2020, and the FDA is allowing e-cigarettes to be sold during this interim period. The 2009 law leaves it up to states and local governments to regulate all other aspects of how tobacco products can be used, displayed, sold, and distributed. Last December, in an effort led by U.S. Senator Mitch McConnell, Congress enacted another law that raises the legal age to buy tobacco products to 21 years old nationwide. During the 2020 legislative session, Kentucky passed a similar bill to conform that state law to the national law and also to put the compliance burden on retailers who sell tobacco products to check the ID of the buyers and just to make sure that they are of legal age. So moving on to the next slide, a few laws that exist at the state level in Kentucky are kind of listed here. One law prohibits billboards from advertising tobacco products within 500 feet of school property, but no such state law prohibits any other kind of tobacco advertising close to schools. And I'm very proud of the next law, the statewide tobacco-free schools law. This was a bill that I introduced in 2019, and we had to fight really hard to get it passed, as Bonnie knows. This bars the use of all tobacco products on or in any school property. So a few things that it doesn't do, it does not ban possession. So if a teacher, for example, smokes, she or he doesn't have to leave their cigarettes in the car. Sure that if somebody was trying to quit smoking, that we didn't take away the tools that are proven to be successful in helping them to quit smoking. I'm also proud to say that before we passed this bill, only 42% of Kentucky school districts were actually tobacco-free. And folks were really surprised to hear that when I introduced this bill. People really assumed in a lot of parts of the state that this was already law, but it was not. So as of today, 97% of the school districts have passed tobacco-free campus policies. So congratulations to those of you on this call who fought for these laws to protect our students from exposure to tobacco use, and especially at school where we need to be setting a positive example for kids. So I already talked about Kentucky's Tobacco 21 law, which just became law on March 26, 2020. It's now illegal in Kentucky for retailers to sell tobacco products to anyone under the age of 21. Retail clerks who fail to adequately check a customer's ID are subject to fines starting at $100 to $500 for the first violation, and then $500 to $1,000 for every subsequent violation. And the owner of the retail store can also be fined. States can also impose excise taxes on tobacco products, and these taxes are proven to reduce tobacco use, especially among youth, pregnant women, and persons living on low incomes, as was discussed a little bit before. Those are the people who really get the biggest health benefit from these tobacco taxes. During this year's legislative session, we decided to tax e-cigarettes, and there was a lot of discussion about the rates and whether we should tax them at the same rate as cigarettes. But ultimately, we decided to adopt what's called a bifurcated tax, and that imposes the highest tax on these type of e-cigarettes that are most popular among youth. It's $1.50 per pod tax, goes into effect August 1st, And that will include both Juul-like products with these replaceable Juul pods, as well as the products like Puff Bars, which have the juice pods built into a little disposable device. Kentucky's Constitution prohibits local jurisdictions, though, from imposing any excise taxes on tobacco products. So that's really what we're talking about today, not just taxes, but ways that we really give local jurisdiction some control. So now we are looking at local laws to regulate the use and the marketing and the sales of tobacco products in Kentucky. And there's really only one law that local governments can adopt, and that's a smoke-free law. Now, smoke-free laws prohibit the use of tobacco products that emit dangerous chemicals into the air, of course, in indoor environments where residents really have no choice whether to breathe it or not. And I would add employees as well. So factories, offices, restaurants, bars, bingo halls, and government buildings, for example, are all some good examples of indoor environments where folks really have no choice if they're working there or if they have chosen to go have dinner and smoking is allowed. Obviously they'll be impacted. So a good smoke-free law requires people who want to smoke or vape to step far enough outside these indoor spaces so that others can breathe air that is not polluted with nicotine and carcinogens and heavy metals that are emitted in secondhand smoke, and the e-cigarette aerosol. So as of today, 56 cities and counties have enacted smoke-free laws. Comprehensive smoke-free laws protect 36.2% of our state's population. So for those of you who are living in communities without smoke-free laws, I would just suggest considering this as a first step. These laws are proven to cut smoking rates, to improve overall community health, and just reduce our health care costs on a state level. Not to mention, the cost incurred just by driving up the cost of health care for everyone through our, the insurance that we pay. So right now, that's the only tobacco use reduction ordinance that you can adopt. All other ordinances governing the use, display, sale, or distribution of tobacco or vapor products are prohibited by state statute passed nearly 25 years ago. So that means that you cannot require a health warning on any displays of tobacco products. You cannot prohibit tobacco retailers from locating closer to schools and playgrounds, and you cannot prohibit this would allow you, I should say, to at least prohibit tobacco retailers from putting tobacco advertising in their windows where any nearby kids can see. So all of these things are just small ways that make a big impact. And I strongly believe that it's time to change what our local municipalities and our cities and counties can do to really give Kentucky cities and counties more control to reduce tobacco use and improve health in their communities. And so I will be joining with our next speaker, Senator Julie Rocky Adams, in introducing legislation for our 2021 General Assembly to do just that. So I thank you very much for this opportunity, and I look forward to answering any questions.
Thank you so much, Representative Mosier. We're excited about the bill that you're going to be introducing because it's clear there's much more that Kentucky could be doing to improve its health by reducing tobacco use. Our next speaker before questions is Senator Julie Rocky Adams, Majority Caucus Chair in the Kentucky State Senate. Senator Adams has served in the legislature since 2011, first in the House and now in the Senate, and also strongly supports the role that policy plays in improving health and reducing healthcare costs. She's going to discuss the kinds of tobacco control policies that city and county governments would be able to enact if we repeal the state law preempting local control. So, Senator Adams, please.
Thanks, Bonnie. I appreciate the opportunity to present to this group, and I apologize if there's noise in my background because my cat is knocking things off of my desk as we speak. So I apologize in advance for that. And I also want to thank Kim for her presentation. She is an excellent partner in the General Assembly, so we kind of tag team House and Senate, and hopefully we can continue our good streak of, passing some good laws as we approach the upcoming session. So we do have several good laws that help reduce the use of tobacco and mitigate the damage it causes to our people and our business community. But there certainly is a lot more that we can do if we weren't preempted by this, I think, outdated state law. So the next slide, I think, is up. Okay, so here we go. So, but how did the preemption come about in the first place? A tiny history lesson for everybody, but according to the documents from the big tobacco companies, preemption was a strategy to overturn or prevent adoption of local ordinances that governed how tobacco products were marketed and sold in their communities. It started about the mid-1980s when the industry became concerned about a growing number of local tobacco control ordinances that were reducing smoking rates. Their first tobacco control preemption success was a law passed in Florida that year. So big tobacco companies knew that they would have a harder time winning in these local communities where elected officials are much more likely to listen to their health departments and their constituents than to the big-time lobbyists. So preempting local laws effectively stops the community discussion, and it reduces enforcement because local agencies are more likely to enforce restrictions than state authorities. And in contrast, they had a much easier battle in the state legislatures. So if they could push the preemption measures at the state level, they could focus their effort in 50 state legislators instead of hundreds of local communities. And I remember talking to a tobacco lobbyist once, and he just said to me, he's like, we just don't have the bandwidth to go put out these little fires everywhere. It's much easier for us to go, hire somebody in that state and take care of anything that pops up. So that was their strategy. And you see in the 1994 quote from Tina Walls of Philip Morris on this slide that she was talking about local smoke-free laws. And she also said, accommodation and preemption laws shape the real-world environment in which our customers and their non-smoking friends and associates live every day. If smokers are banished to doorways and loading docks in front of buildings, it makes smokers feel like outcasts and gives encouragement to the antis. On the other hand, if we live in a society to accommodate smokers and non-smokers alike, it sends the message that smoking is a viable lifestyle choice. By introducing preemptive statewide legislation, we can shift the battle away from the community level back to the state legislatures where we are on stronger ground. Okay, next slide, please. So many of you might raise concerns about tobacco farmers in your communities. I know this is always a conversation that comes up when we talk about anything related to smoking in the General Assembly. And they're your constituents, and tobacco farming is their livelihood. So, I get it. It's a real issue that we have to talk about. But there are a lot fewer Kentucky farmers today than there were when these preemption laws went into effect. And the value of the tobacco crop has declined considerably as well. As you can see, the crop values and tobacco acreage and farms outlined on this slide. And in contrast, the healthcare costs of treating tobacco-related illnesses are enormous. And it's shocking to me that while the value of Kentucky's 2019 tobacco crop was about $270 million, the healthcare cost for tobacco disease funded out of taxpayer pockets was more than twice that, nearly $600 million. So that's $1,100 per household in extra taxes that families in Kentucky pay to treat tobacco-related diseases. And let's go to the next slide. And I told Bonnie, she said, do you want me to do the slides for you? And I said, I cannot. The less buttons I push on my computer, the better. So I hope you all don't mind me saying next slide. Okay, so here we are, the local control campaign. So as Representative Mosher said, The one local ordinance that's not prohibited by state law is a smoke-free indoor law, and that's not preempted by KRS 438-300. If you want to do more to reduce tobacco-related illness and costs in your own communities, you need the authority to do so. So Representative Mosier and I will introduce a bill for the 2021 legislative session to do just that. But we need support from local policymakers and community leaders to help this bill pass. So your state representatives and your senators always listen to you. And so we need them to hear you on this bill that we are going to introduce. So next slide. So the bill is really a simple fix. It simply repeals language that bars local tobacco control laws that govern the use, display, sale, and distribution of tobacco products. And tobacco products include vapor products such as e-cigs and the hookah. The bill doesn't tell local jurisdictions what they should do or that they have to pass tobacco control laws. It just simply gives them the right to do so if they choose. It's a simple fix. And what I really like about it, it just allows for the reality that each community is unique and may have varying ideas as to how best to implement health policies in their own communities. You know, that's, I think, one of the biggest struggles from a state perspective is when you pass a law, you're passing this blanket law and you're hoping that it will be flexible enough to deal with the nuances of each local community. And so that's why I think this local control is such a great idea, because it allows for those local communities to capture those nuances and what's right for them. Okay, and then our last slide. We can't get this bill passed without your support. So here are some things that you can help us do to pass the bill to gain more local control. Learn about the impacts of tobacco use in your community. And when we understand that tobacco use costs us far more than it brings in, we really want to do something about that. The American Heart Association, the Foundation for a Healthy Kentucky, and Kentucky Youth Advocates are happy to help you put together a community conversation about local tobacco control. I'm sure your local health department would be more than willing to help as well. So help your community understand that cost of tobacco use and the steps that can be taken to reduce those costs. And call, or contact your state legislator. Phone, email, drop by to see them, and let them know that you want the right to govern tobacco marketing and sales in your own communities. And I'll tell you, this is really, really important, because I have heard from every single person I've ever served with, gosh, I've had 20 emails on that, or I've received 30 calls on that, or, you know, I got stopped in the grocery store that, you know, someone was talking to me about this. They really do listen. I always tell people, don't contact a legislator if they're not yours, because they don't care. If you can't vote for them, they don't care. But if you contact your own, then that really is a significant, and that makes a significant impact on that individual. So I can't stress that enough, is really contact your state legislator. And then please share this information among your networks. As a state senator, I really look at the messages I get from my own constituents, and when they're up in arms about something, I want to help. And so it's just really important that we hear from you. And also, this is going to be a calendar item for all of you all on the call, that we're going to have a news conference in the Capitol very early in 2021 to show support for local tobacco control. So watch for the invitation in your mailbox, and we'll all have a good time together there. And so I think now Bonnie is going to take some questions for us, and Kim will get all the hard ones, and I will get all the easier ones.
Oh, no. You're so funny. Thank you so much, both of you. I can't stress how important it was to have you guys, both of you, on the webinar here, because we need to understand what your preferences are, what your priorities are, and what works to get these bills passed. The first question that we had is, given that we know certain policies prevent smoking uptake and reduce smoking rates, why are we focusing on preemption versus strengthening state laws? And the writer gives an example. There's still a lot of variation in smoke-free laws statewide. Do you think there is more support for ending preemption or more support for a statewide smoke-free law? Let's start with Representative Mosier on that.
Okay, thanks, Bonnie. And everyone can see why it's so much fun to work with Julie. So we have a good time, but she's also super smart and, you know, really helps all of us think through the details and nuances of these bills. And we love working together to get these sorts of things done. So in answer to this question, I believe that a local option would be more supported in the state legislature. And, you know, Julie can give her opinion as well, but we've seen how difficult it is to pass something that is, in my opinion, as common sense as a smoke-free school law. We had multiple discussions, many discussions about the pros and the cons, and it just, in fact, that bill had been proposed, I think this was the third year that we finally passed it. And it had been started in the Senate for several years and passed without any problem. But we have 100 members, of course, in the House, so it's a little more difficult. We have more opinions. And then, you know, some of our rural legislators were just very concerned still about tobacco farmers, as we all are. But we had to really do a great deal of education. And so I would say that from a statewide blanket kind of law point of view, I just don't see that a statewide smoke-free law would pass. I really think that folks are more inclined to talk with their local officials and really understand community needs and the impact that tobacco use has on local communities. And really, you know, we heard a great deal about grassroots efforts earlier, and I think that's really where this starts. So, Julie, do you have anything to add to that?
Yeah, well, first of all, I agree with every single thing that Kim said, because it's we've tried and we've tried and we've tried, and it just seems to be something that it's just a really difficult thing to do. It's not that we haven't tried; it's just really difficult to do. And also, you know, we hear all the time when we have people come up is, you should let, you know, we're tired of the state telling us what to do. You should let us have local control. And, you know, we talk about local control and education and, you know, policing and all these types of things. Well, why don't we have local control on how to regulate tobacco? And I think that it's, you know, kind of in line with what we hear quite a bit in our offices from people is, well, you know, we can make the best decisions for our community more than you can. And so let's give it a shot.
That's great. That's great. I appreciate those answers. Representative Mosier, Senator Adams talked about the importance of local officials contacting her to really raise the level of interest by the state legislature in passing legislation. Would you mind commenting on that as well? Are you hearing from your local constituents there in northern Kentucky about health issues related to tobacco and getting ideas from them about what they'd like to see done?
Yes, especially on the e-cigarettes. That was a very hot topic this past session. Early in, I guess, last summer, we started seeing some really negative health effects, especially in youth, when it came to e-cigarettes and the use of Juuls and pods and so forth. So that was a big discussion with many of my constituents. In fact, our local health department did a whole presentation on e-cigarettes and the dangers of these products. So, you know, and it all led up to the conversation about taxing. And, you know, the e-cigarettes had really flown under the radar of taxation and the excise tax when we added or increased the tobacco tax in the previous budget. And so that was really how that conversation got started. I expect that this will be a larger conversation because it's all tobacco products. And, I do hear, and I agree with Julie, that I hear about the desire for local control, and I really feel like that will appeal to our constituents. And I agree also that, folks do say, we don't like it when the state comes in and tells us what to do. And so, I think that this is a really easy fix. It's something that just allows the local option. It's not a mandate of any sort. It's just the option. And I think that that's really going to stimulate a good conversation.
Good. Senator Adams, we have a question. Will this local control policy extend to legalization of marijuana that may occur in the future? So is it
I don't know
just
how to
tobacco
answer that.
or is it marijuana? Okay.
Yeah, in my brain right now, it's just tobacco because we've had, another uphill battle on the medicinal marijuana conversation. And so if we combine the two, I think we're going to complicate it and not get anything done. I think it's that old saying, how do you eat an elephant? One bite at a time. I would like to see this be one bite at a time and see if we can't make some progress on this.
Representative Mosier, would you agree that narrowing it to tobacco is a more likely, gives us a higher chance of success?
Absolutely. We have to keep those two issues separate. They're very different issues. Medicinal marijuana has nothing to do with the use of or really control of tobacco use. We're talking about really apples and oranges, even though they're both smoked. The tobacco issue is really about how to improve health from the reduction of these carcinogens and the tobacco products that we know are dangerous to our health. Now, the medicinal marijuana is a completely different conversation. If, in fact, it is a medicine, then it needs to be proven, and that would be, for medical purposes. So I would say, yeah, we need to keep that conversation separate and just, really focus on tobacco because we don't want to muddy the water with, any other issues.
Right.
That, can crop up. Mm-hmm.
Okay. We have a question. The Coalition for a Smoke-Free Tomorrow, the two of you and Senator Alvarado have been advocating for a number of bills in recent years, and you've had success in passing a cigarette tax and passing tobacco-free schools and passing an e-cigarette tax. The question is, when will enough be enough? Senator Adams, you want to start with that one?
Yeah, I think enough is enough. I struggle with all of these policies because, I felt as if we had made such great progress in almost excluding, the generation of our kids right now from the ills of cigarette smoking. And, it was really frowned upon. And then comes the rise of the vapes. And we've hooked a whole nother generation on this next product. And it's just really sad and frustrating to me that we are continuing to, play defense with an industry that I think is, really concerned with profits over health. And I think until we start to see in our state a trend change with the amount of money that we spend on these health-related issues, we haven't finished our job. And so it's not enough, that we have to keep plugging along and filling the holes where we can and continuing this advocating of, I think, which are really sound policies, and they're really good for people and families and communities. So I'm ready to fight. I don't know if that's kind of what the answer they were looking for, but, I'm still committed to, changing that discussion in Kentucky and changing those outcomes in Kentucky.
Well, as a health advocate, it's certainly an answer that I'm looking for. Representative Mosier, would you care to comment on that?
Sure. Yeah. I appreciate that question because we know that legislation is not the answer to everything, and we certainly don't want to dictate or micromanage everyone's daily life. That's not what this is about. It's really about how can the legislative efforts and legislation, how can it be supportive of our communities and our citizens? How can it help educate? How can it make it easier for our local jurisdictions to take control of their communities and do what's best for them? And so, really this is getting government out of the way of helping our citizens. And, it's really kind of shining the light on what big tobacco is doing, continues to do, despite our efforts, despite our good efforts, to really, as Julie said, educating kids about the dangers of smoking, and then, along comes vaping and e-cigarettes. And it's just, it's almost whack-a-mole. You just have to stay ahead. But I think when we give the control back to the local jurisdictions and the local cities and counties, that they can really tailor any ordinances to what's best for their community. So, hopefully we can just, as I said, make it easier to improve the health of our citizens.
Thank you. The next question is, where will the opposition come from on this bill, and how will we speak to that opposition? Representative Mosier, would you like to start on that question? Where do you expect opposition?
Sure. Yeah, I think that the obvious area is big tobacco. I mean, they love a good blanket state law to just control what happens on a state level, and that way they don't have to get into each community and fight to maintain their business operations and their livelihood. I mean, when it all comes down to it, it's all about money for big tobacco. I'm not convinced that even e-cigarettes are anything altruistic on their part. Yes, it probably has helped some folks quit smoking, but I don't think anyone could convince me that it's their best interest. Yeah, so it's going to be big tobacco.
Okay. Senator Adams,
yeah,
would you
and
I'll follow up with anything?
Yeah, I'll add, and I think still that there's this kind of divide. A lot of times I say a lot of the issues that we deal with are not Republican and Democrat; they're rural versus urban, and so I think that it's really important that we engage the rural aspects of our state in this issue, so that there is more of a feeling of trust that if the legislature allows these rural communities to control, that they're not going to go, woo, we're going to go crazy with all the things we're going to do. I mean, I think that level of trust that we can make between those rural state legislators and those community activists and local elected officials is going to be really key to making this happen. I'll use the example of Louisville. This is a super easy vote for me and a super easy bill for me to carry and advocate for, because we have a smoke-free ordinance in Louisville and people are used to it and they like it. And so any modification to that is not a scary thing for people in Louisville. But if you don't have a smoke-free ordinance and you're in a rural part of Kentucky, then you don't know what you don't know, and you don't know what might happen. And so there's that level of, what are you going to do to me? So I really want to engage those advocates in those communities in talking to their legislators and saying that this is okay to do.
I think that's important, those rural communities in some of our counties. While our statewide smoking rate is 24%, some of our counties have much higher. Monroe County, it's 49%. So there are different issues in different counties, and as one of our speakers said, I think it was Elizabeth Anderson Hoagland, different types of products are popular in different parts of the state. We have a high smokeless tobacco use in some parts of the state among youth, and a high vaping rate among youth in other parts of the state, and so it really varies, and this allows for that variation in approach as well. I have one last question, and that is, I would like both of you to briefly address, is this a slippery slope? If we allow local control for tobacco, will it slip into other issues as well? Representative Mosier, would you like to begin?
Sure. I think because this is so specific and addresses only tobacco products, I think if we just, maintain that focus, that will be okay. Nobody wants a slippery slope, but, as I said earlier, if we can get government out of the way of our local jurisdictions and our cities and counties, that, this will, I think, strengthen what they can do. So I don't really see this particular preemption or ban or repeal rather of the preemption laws as a slippery slope, because we are going to be very specific to the tobacco issue.
Thank you. Senator Adams, any final comment?
Yeah, I agree 100% with Kim. I think that this is it's packaged as its own presence, and we'll keep it focused. I hear a lot, just being from Louisville, about being allowed to have Louisville have different gun laws. This is the only thing that popped up in my brain as you were asking the question is, can we have stronger gun laws in Louisville as opposed to the rest of the state? This is so much different. This conversation is so much different than that conversation, and we just need to stay focused that this is the only aspect that we want to push, and this is important to our communities, and there you go.
Wonderful. Thank you both so much. I can't tell you how important it was to have the two of you, especially together, on this webinar, sharing back and forth. The perspectives are so important, and both of you being leaders for health issues in your respective houses is so important. So thank you for spending your time with us. And as we noted, this webinar is being recorded, and so it will be posted so that others can hear your wise counsel to us and your thoughts to us. So thank you again so very much.
Thank you.
You're welcome. This morning's final distinguished guest speaker, you're so welcome, thank you, is Dr. Brian King. He is Deputy Director in the Office on Smoking and Health at the Centers for Disease Control and Prevention, the CDC, which is the lead federal agency for comprehensive tobacco use, prevention, and control. Dr. King has worked for more than a decade to provide sound scientific evidence to inform tobacco control policy. He was a contributing author to the 50th anniversary Surgeon General's Report on Smoking and Health, and Senior Associate Editor of the 2016 Surgeon General's Report, E-Cigarette Use Among Youth and Young Adults. I also listened to a presentation that he gave yesterday on the latest report, which was about smoking cessation, and appreciated his expertise there. Dr. King holds a PhD and a Master's in Public Health in Epidemiology from the State University of New York at Buffalo, and he is going to speak today about the evidence for local tobacco control policies. Do they work, Dr. King?
Well, hello, Bonnie, and everyone. Thanks so much for the opportunity to be here today. I'm pleased for multiple reasons. One is I just got off a 60-day COVID-19 deployment, so I am pleased as punch to be talking about anything besides that right now. And it's great that folks have not forgotten about the leading cause of preventable disease and death in this country. And I'm also pleased to be speaking to folks from Kentucky. My brother actually lived in Wilmore outside Lexington for many years, and I am an ardent patron of the Derby every year. And so I hope to be up in September of this year if things settle down on the COVID front. So I've tailored today's presentation around a Back to the Future theme. I'm really getting at this notion that when it comes to tobacco control, we've had a lot of change. It's a very dynamic landscape with a lot of new products, but the general gist here is that it's a lot of the same old things. It's just a different product, different chapter in the same old story. And so it's really important us to remember that. And by the end, I really want to reinforce this notion that we know what works when it comes to tobacco control, and it's just a matter of us keeping pace with this evolving landscape of products and policy, whether it comes to the research we do, the public health messaging we do, or the public health practice and policy that we do. So without further ado, I'm going to start with the past, and then we'll transition to the future over the next 15 to 20 minutes. Now, when it comes to the past, the tobacco control field has the luxury of over a half century of science showing us what works. A lot of risk factors when it comes to public health don't have that luxury. The first Surgeon General's report on this issue was released in 1964, and so that was over 50 years ago. And since that time, we've released 34 Surgeon General's reports articulating what the health risks are, but importantly, what works to effectively address those health risks. And when it comes to smoking, we know that it remains the leading cause of preventable disease and death in this country. Over 34 million American adults continue to smoke, with marked variability by states. Kentucky and West Virginia have had the highest rates of smoking, which is no news to this audience for many years across the country. And we also know that there's significant deaths from smoking, 480,000 deaths per year. And for every person who dies, 30 people are living with a smoking-related disease. And we also know from public health that money talks frequently more than the health argument. And to that end, $300 billion are spent each year in this country for direct health care costs for smoking, as well as lost productivity. And when it comes to smoking attributable disease, the bottom line, folks, is that smoking harms nearly every organ of the body. It causes 12 cancers, as well as coronary heart disease and other chronic diseases that you may not necessarily think about, things like type 2 diabetes, ectopic pregnancy, and even rheumatoid arthritis. And then there's also some that speak to some of the younger audiences, which I frequently find with the young male audience, male reproductive issues that can be impacted by smoking. And so there's a lot of different health risk factors beyond the typical lung cancer that we normally think about. Now, the good news is that smoking has been coming down in this country. For many years, from about the mid-1960s among adults and since about the late 1990s among youth. It peaked in the late 90s when the Master Settlement Agreement was implemented, which was the agreement between the state's attorney general from 46 states and the tobacco industry, and they removed a lot of advertising. In terms of billboard advertisements, sporting endorsements, but the industry also shifted at that point, so they went to the retail sector at that point, and now that's why we see a lot of advertising for tobacco still in that place. But the good news is that smoking rates are coming down, particularly in recent years, and definitely among youth at all-time record lows. But the bad news is that disparities persist. And this is one of my soapboxes, that we can't be celebrating in the streets around the declining rates if we don't look at disparities. And this is especially important because although rates are coming down overall, once you separate them out by different population groups, you see markedly higher rates among certain vulnerable populations, including by race ethnicity. American Indians, Alaska Natives have nearly twofold higher rates than the general population. People with lower education, lower income have higher rates. Those who are uninsured or who are on Medicaid, those who have disabilities, LGBT Americans have higher rates than heterosexual straight Americans, and also serious psychological distress, which is a proxy for mental illness. This is one of the greatest disparities in this country. We know that about 40% of the cigarettes consumed in this country are among people with mental health related issues or substance use disorder. And so marked disparities, again, reinforcing the fact that we cannot leave people behind. And what gets measured gets done, and so we've measured it. We know that these disparities exist, and now we have to make sure that we're not leaving people behind and that our policies effectively address all these populations. Now, another wrench in our wheel is the tobacco product landscape continues to diversify at a rapid rate. There's a variety of combustible, non-combustible, and also electronic products, including e-cigarettes. And so as we move forward into our future tobacco control-related efforts, we have to be mindful and nimble about the fact that there are a variety of products. And cigarettes are not just the only game in town, particularly when we're talking about emerging products such as e-cigarettes. And that gets us into the present of where we are in terms of burden of tobacco use. When it comes to adults, cigarettes remain the primary burden. About 75% of adult tobacco product users are using cigarettes, but it's actually the converse among youth. E-cigarettes have been the most commonly used tobacco products among youth since 2014, and we've seen an evolution, if you will, of these products over time. When they first entered the U.S. market in 2007, they were disposable varieties, similar in size and shape to regular cigarettes, and they've similar to an iPhone. They got bigger, and then around 2015, they got smaller and smaller, and now the pod mod, or the fourth generation device such as Juul, is the most popular, where the user can easily just put a pod in a very easily concealable device and use it discreetly. We also know that the nicotine concentration in these products have increased over time. A key characteristic of these pod mods is they also use a new form of nicotine called nicotine salt. It's not the free-based nicotine that was in older e-cigarettes or older conventional products like cigarettes. It allows nicotine to pass the blood-brain barrier easier. So higher levels can go down a lot easier. And so that's particularly concerning to youth, and particularly naive populations who have never been exposed to nicotine now have a mechanism to be exposed at higher levels and subsequently more dependent and more addicted. And that's what we're seeing in the data. If you look at this chart, the red line is the e-cigarette estimates. You've seen that it's been steadily going up since 2011. We did see a decline in 2016. What happened there? That was we started to implement population-based public health policies. Again, we modernized the policies to address all products, including e-cigarettes. And then we saw a bit of a plateau, and then things started to go up again in 2017. What happened there? That was the emergence of the pod mod and products like Juul. If you look at the retail sales of Juul, it mirrored very closely to the increase in youth e-cigarette use that we've seen. But it's not just that more kids are using e-cigarettes. Among those who are using them, there's more frequency of use. And so what does that tell us? It tells us higher dependency, higher potential for addiction. And that mirrors this fact around these nicotine salts. And so it's not just a problem that more kids are using the product, but among those who are using them, you've got higher dependence. So what is leading to these increased rates of use among youth? Well, it's very similar to what was the fact for conventional cigarettes for many years. And so I was on the Today Show about a year or so ago, and someone, the interviewer had asked me, well, what is the primary causes of this, youth epidemic, as the Surgeon General has called it? And I summed it up like this. Well, advertising will lead a horse to water, the flavors will get him to drink, and the nicotine will keep him coming back for more. And so that's that trifecta of factors that are influencing youth use. We know that about 70 to 80% of youth are exposed to e-cigarette advertising in this country. About 70% of youth who are using e-cigarettes are using a flavored variety, and it's one of the primary reasons they report using the product. And then, again, most of these products contain nicotine, which is highly addictive, but it can also harm the developing adolescent brain, impacting the prefrontal cortex. That's the part of the brain responsible for learning, memory, attention, all things that we need our kids to be able to have, to be upstanding citizens moving forward. And so this trifecta of factors are really influencing this epidemic. Now, I showed on that previous slide that about 27.5% of U.S. youth are using e-cigarettes, but it's markedly lower among adults, and that's why we're so concerned about youth use. So it's 27.5% among youth, and 3%, just over 3% among adults. So talk about marked variation. And it's higher among younger adults, about 8%. But when you go among all adults, it's about 3%. And we've actually been going down over the past several years. So the complete opposite trend in kids. We saw a little bit of an uptick in 2018, and we believe that's also a result of Juul and the young adult use. But the bottom line is there's a very good reason why public health is so irritated and working diligently to address this issue of youth e-cigarette use, because the population for which there's no redeeming aspects of these products are the ones with the greatest burden of use. And it reinforces our efforts in redoubling down to address youth and young adult use of these products. Now, there's a big debate around e-cigarettes, and is it public health promise or its peril? The bottom line here is that we know that e-cigarette aerosol contains markedly lower levels of harmful ingredients than conventional cigarette smoke, but that doesn't mean that there's no health risk. Okay, and I'd also counter that there's 7,000 chemicals and 70 carcinogens in cigarette smoke. So on balance, most things are safer than that. So it's a pretty horrifying public health standard. So when it comes to an adult smoker, if they were to use e-cigarettes to transition completely from cigarettes to e-cigarettes, there would be a net benefit for that individual. But on balance, you have to quit completely, and the science is still uncertain on whether e-cigarettes are effective for cessation. The recent Surgeon General's report said there was inconclusive evidence. And irrespective of any potential benefit among adults, it can't come at the expense of our nation's youth and the escalating epidemic rates of use that we're seeing among kids. And so it's absolutely critical that we continue to implement these types of strategies that are going to help mitigate youth access and use of these products. Now, when it comes to, what we can do, public health actions to address tobacco products. We don't need to reinvent the wheel, folks. We just need to grease that squeaky wheel to ensure that our interventions address the diversity of different tobacco products that are out there, whether it be conventional cigarettes or these emerging products like e-cigarettes. And to that end, the Family Smoking Prevention Tobacco Control Act at the federal level has a lot of restrictions on manufacturing, marketing, and sale, but importantly, it doesn't preempt states from implementing policies. And indeed, that's been the bread and butter of tobacco control for decades, local control. And that's why it's so critical that preemption not be in place, because it inhibits localities who know the key decision makers, who know locally salient information and data to make the decisions about their respective jurisdictions. And so that's why it's so critical that states and localities are able to continue to implement these types of strategies. And there's a variety of things that they can do, including some that the federal government doesn't have the authority to do. Things like smoke-free policies are strictly a state or local policy. Same thing with pricing strategies. So when it comes to what strategies work, this is something I've been harping on for decades, called the tobacco control vaccine. It's something I thought up when I was on the elliptical about a decade ago. A lot of people were coming up to me saying, wouldn't it be great if we had this vaccine that would prevent people from nicotine addiction? And my response was, well, yeah, that's great. There are people working on that. But we already have our vaccine, folks. We have the evidence-based, population-based strategies. And if you inoculate the population with these interventions as a part of a comprehensive approach, you're going to help prevent and reduce use. And that includes things like tobacco price increases, smoke-free policies, hard-hitting mass media campaigns, and also cessation access. So where are we with these four-scale proven interventions that we know work? Well, here's cigarette excise taxes. The lowest level is actually on the far right, so this is a little confusing, so I apologize. But the dark one is less than 50%, and then things go up from there. So you can see that there's a broad range. So from about 17 cents in Missouri all the way to well over $4 for the state of New York. Kentucky is about in the middle in that light green shaded square, but you can see that there's marked variability, and it's no surprise that the states with the highest taxes have the lowest rates of smoking. And I'll also reinforce that a lot of times people are very tax averse. Well, there's a lot of different ways that you can increase price without implementing a tax. There's a lot of momentum around minimum price laws, preventing buy downs and couponing by the industry, which effectively reduces the price and circumvents cigarette tax efficacy. But there's a lot of ways to increase price, but the bottom line is we know that increasing price is the single most effective intervention for reducing consumption when it comes to cigarettes. We also know smoke-free policies are effective. We've made a lot of great progress on this front. We now have 26 states in the District of Columbia that have comprehensive smoke-free laws in work sites, restaurants, and bars, but we still got more work to do. We've got 60% of the population covered by comprehensive smoke-free laws, but there's several states that do not have statewide laws, including localities within states without preemption that have not done so. We know smoke-free policies not only reduce secondhand smoke exposure, but they also promote cessation, and they can prevent initiation among kids. It's also important that we have resources for cessation, and so that includes quit lines, which not only allow people to get counseling, but they also in many cases offer free nicotine replacement therapy. And so that combination of counseling and nicotine replacement therapy can double the chances that you quit for good. So it's not just the population-based strategies that help prime the pump in terms of preventing and reducing use, but also access to resources around cessation to help people quit. And then finally, we're in a golden age of mass media campaigns. We know mass media campaigns are effective for preventing initiation and also reducing use through cessation. So CDC has our famous TIPS campaign, but also FDA has a youth-focused campaign, and of course, Truth Initiative, who has been in this space for many years, again, helping to warn about the risk of all forms of tobacco products, including emerging products like e-cigarettes. But importantly, like TIPS, transitioning people to cessation resources. And so you always see the 1-800-QUIT-NOW, the smokefree.gov resources on those ads to ensure that people get the resources they need to help quit. So now let's go in the tail end to the future. Where are we at? Well, our vaccine needs a booster, folks. It's a very evolving landscape, and that means that we have to be nimble in terms of what we do. So there's a lot of emerging strategies that are complements to the booster, whether it be Tobacco 21, smoke-free multi-unit housing, tobacco-free college campuses, tobacco-free pharmacies, tobacco-free sporting venues, and then leveraging things like e-referrals, digital media, restrictions on flavors in the point of sale where we know a lot of advertising is occurring, and also some of those alternative pricing policies that I spoke about. So it's really important that we're nimble here in terms of our research, our policy, and our practice to make sure that we adapt as the industry continues to adapt to maintain their income lines around the diversity of products they're selling. And to that end, there's a lot of new products entering the landscape. E-cigarettes were not the first, and they're certainly not the last emerging product. Heated tobacco products, including IQOS, have hit the market within recent years. FDA allowed the sale in the United States last year, and so they have been available in several jurisdictions, and they were even test marketed in Atlanta, down the street from CDC. And also nicotine pouches are another product that's making a promotional surge across the country. And these products are spitless, so it doesn't necessarily have the same messiness as a smokeless product like chew or dip, but these are products like Zyn or On have been making advertising headway in several jurisdictions across the country. But in addition to the emerging products, we're also seeing emerging strategies. An example is the recent FDA minimum age of sale. They raised the age of sale to 21 in December 2019. This wasn't necessarily a new strategy. We had well over 20 states that had already done this, and the state of Massachusetts, actually, there were jurisdictions that have done this all the way back to 2005. But this brought it into a national policy, which again is one more tool in our toolbox to help effectively reduce youth use and young adults as well. And then also flavor prohibitions. In January 2020, FDA implemented a policy that enacted their enforcement discretion, which effectively would remove all flavored products off the market when it comes to e-cigarettes, and would require the manufacturer to implement an application to reinforce how it would benefit public health if they want it to go back on the market. So here are the key takeaways if I put you to sleep. If you get anything out of this, cigarette smoking remains the leading cause of preventable disease, disability, and death in the U.S., so we can't forego those efforts. We definitely need to address the 34 million Americans that are using smoking, particularly since 75% of adult tobacco users are still smoking cigarettes. And to that end, progress has been made in reducing smoking nationally, but again, disparities persist. Also a problem, the tobacco product landscape continues to diversify. We do not want to be playing a game of public health whack-a-mole, where we allow certain products to go down and others to go up. We have to be nimble as a public health community to address the diversity of products. And when it comes to that end, we know what works. We don't need to reinvent the wheel. We just need to grease that squeaky wheel to ensure that our interventions are addressing the diversity of products that people are using. And so to that end, this is my contact information. I've got a famous email. It's baking@cdc.gov. So you can send me your favorite recipes or your questions about concerns over salmonella and cookie dough. You name it, I've probably got it. But I'm happy to answer tobacco control questions or triage you to folks who can. And importantly, cdc.gov/tobacco. We're now on all major social media, even on Pinterest. So if that doesn't get you excited, I'm not sure what will, folks. So with that, I'm happy to answer a few questions.
Brian, thank you so much. I greatly appreciate the depth of the information that you went into, and we will be providing all of the slides to all of our participants. So the detailed information that he provided, we will all have access to after the fact, and you'll all be getting that email within a day or two. Brian, you talked about tobacco products diversifying over time, but our environment has changed too. Can you address tobacco use during the pandemic and the relationship between COVID and tobacco use?
Yeah, certainly. So the science is still evolving on the relationship between smoking and COVID-19. What we know based on the current literature is that among people who smoke, there's a higher likelihood that they'll have more severe outcomes from COVID-19. So if you get it, higher likelihood of hospitalization or even more severe adverse health effects from COVID-19. When it comes to higher risk of infection, the jury's still out. We just don't have enough data to determine whether someone who smokes is at higher risk of getting infected with SARS-CoV-2, which is the virus that causes COVID-19. There's a lot of discussion around smoking potentially being a protective effect. The available science does not indicate that. There's some studies that have found that, but they've had some considerable limitations that should urge caution when interpreting them. So there's a lot of discussion around the potential for nicotine to potentially be protective. The science doesn't show that conclusively, and so we should be very mindful of continuing to warn people about health risks, particularly for smokers, since it can increase the risk of more severe outcomes. When it comes to trends in smoking, we actually saw an increase in sales right at around the time of the pandemic occurring in early March. We believe that was hoarding behaviors, that people were stockpiling in anticipation of being in quarantine. And then we've seen declines in sales since that time, and they are about to down where they were before the pandemic started. So we'll need more data longer term to see the long-term impact of what COVID-19 has had. But at present, in terms of sales, we saw a sharp uptick, which is now back down to about where it was. In terms of whether this is going to cause more people to use products in the long term or maybe even less since they haven't had access, we just don't know at present. But the bottom line is now is a better time than ever to quit all forms of tobacco product use, and that includes smoking, given its risk of more severe illness from COVID-19.
And so far, there's no real evidence about e-cigarette use in COVID. Is that correct? Because it's just too soon, too early?
Yeah, that's correct. There's no studies on e-cigarettes in either SARS-CoV infection or COVID-19. There's some folks talking about nicotine as potentially playing a role in susceptibility to COVID-19, but the science just is not robust enough to make any determination. So right now, the CDC has not made any recommendations around e-cigarettes in the context of COVID-19, but our same recommendations hold that youth shouldn't be using any form of tobacco product, including e-cigarettes. And for adult smokers, the only benefit is that they transition completely. Otherwise, young adults, pregnant women, and people who are not currently using tobacco products should not be using e-cigarettes.
Okay, thank you. We have a question from a participant. Has there been discussion about improving current regulations, the FDA partial flavor ban, to include disposable products such as the Puff Bar or flavor accessories like Puff Crush Caps?
Yeah, so there's certainly ongoing discussions at the federal level. As I noted before, what's get measured gets done, right? So we need the data. CDC, FDA, and other federal agencies are data-driven federal agencies, and so we use the data to guide decision making. That being said, we do have data from the National Youth Tobacco Survey, which is currently in the process of being analyzed, as well as the Monitoring the Future Survey, which are both government surveys to really get at what has occurred within the past year, particularly within the first few months before we had to pull the surveys out of the field due to school closures. And so we're hopeful that we can use that data to make informed decisions about what the impact has been on the landscape, whether it be, the use of disposable products such as Puff Bar, or even potential use of flavorings that have otherwise been exempted by current regulations. So it's certainly something that the federal government is very closely monitoring. And as FDA has noted publicly, when they initially released their guidance in January, that we continue to do surveillance to monitor that and make modifications to that regulation as needed based on the best available science. So we are anecdotally seeing prominent use of disposable products, particularly among youth, like Puff Bar, as well as several youth reporting using certain flavors such as menthol. But again, we're going to use the data to inform regulatory actions, and that's currently underway.
Okay. All right. Great. I appreciate that. And the preemption bill that State Senator Adams and State Representative Kim Mosier are introducing would allow that people to look at flavors if they chose to do so. They also would look at a variety of other things like health warnings. And we have a question here about the health warnings. So we currently just have the black and white print, and the graphic warnings won't happen in a year and a half down the road. At the local level, they can't regulate warnings on packages, but they could, for instance, do warnings on displays. Do you have any experience on additional sort of warnings that can be posted with local laws that have been effective in reducing use?
Yeah, so on the graphic warning label front, we know that that's an effective strategy to promote cessation. And the 2020 Surgeon General's report that was just released showed that graphic pictorial warning labels are effective. And so the FDA went back to the drawing board on this after losing in federal court to their initial whack at warning labels, and they are in the process of reissuing warning labels on cigarette packs. So we're hopeful that in the very near future at the federal level there will be those warnings on the packs. But in the interim, the manufacturing, marketing, and sale of tobacco products is under FDA's purview, but as I noted, it doesn't preempt states and localities from doing things on that end. And so there's a lot of different ways that localities and states can continue to warn about the risks of tobacco. One of the most effective is really mass reach health communication campaigns. So that can take the form of print media, radio, digital social media, and also television airwaves. And that's really the most effective way to deliver messages around health risks, but also cessation. You can do print-related advertisements, including things at the point of sale, which could be effective in terms of warnings, but the evidence base around those types of point of sales is not as robust as the mass reach health communication campaigns that really get at that broader level of messaging to the broader population. But we know that access point, particularly point of sale, is a very key environment where people make decisions around purchasing. So to that end, you would expect that having warning signage around the health risks of tobacco products, including e-cigarettes, which has been done in several communities, could be effective. But you have to remember that it's balanced by the thousands of dollars that the industry spends to advertise their products in the retail sector. And so frequently those anti-tobacco advertisements are dwarfed by the volume of advertisements and other promotions for tobacco products in these venues. And it's because the industry pays retailers for prominent space, particularly around the counter at the entranceways. There's some studies that have found upwards of 90% of the available wall coverings are for tobacco advertising. And so you can put anti-tobacco ads there, but it's frequently dwarfed by that marketing machine of the industry. And so it's really going to take a coordinated approach to do this anti-tobacco advertising, but one of the best ways is this mass media campaigns that address the diversity of media modes to get the message out to the populace.
Wonderful. Okay. Well, actually not wonderful because it's expensive to do those, but the advice is well taken. So again, thank you so much, Dr. Ting, for once again lending your expertise to Kentucky. You've been at several presentations in Kentucky, both in person and virtually, and we are so grateful for your willingness to lend your expertise here and hope to see you at the Derby this year.
Thanks so much. It's a pleasure as always.
Great. I'd like to extend one more note of sincere gratitude from the Foundation for a Healthy Kentucky, the American Heart Association, and Kentucky Youth Advocates, and to each of today's webinar speakers. Their expertise and leadership cannot be overstated, but it's your leadership, you, the participants on this call at the local level in Kentucky, that we need now. We're going to follow up today's webinar with a short survey that'll be coming out today that we really need you to fill out. That survey email will include an invitation to join our campaign to expand local control of marketing and sales in Kentucky. But even if you can't do that, please fill out the survey. Then within a day or two, we're going to follow up with an email that has a link to both the recording of today's webinar as well as the PowerPoint slide presentations. Please share these links with your networks to continue building understanding and support for the need to increase local control of the marketing and sale of tobacco products in Kentucky. This is the next logical step for Kentucky's community leaders to improve health and reduce healthcare costs among your constituents your neighbors, and your friends. Also, we're going to be making similar presentations to the Kentucky Magistrates and Commissioners Association and to the Kentucky County Judge Executives Association in the coming weeks. If you have an organization that you'd like us to present to, give me a call. My name again is Bonnie Hackbarth, and I can be reached at 502-552-3770, and my email is there on your screen. Thank you again for joining us today. We look forward to working with you and collaborating with you going forward to get this bill passed. Thank you.